Hello and welcome to this video on cleft lip. Today we will be discussing the clinical aspects of cleft lip, including its etiology, classification, surgical management and outcomes. A cleft lip is a congenital deformity resulting from incomplete fusion of the maxillary and medial nasal process during embryonic development. It typically occurs during the 4th to 7th weeks of gestation. Both genetic as well as environmental factors can contribute to the development of this cleft lip. Some common environmental influences include maternal smoking, certain medications, nutritional deficiencies, and exposure to toxins during the period of pregnancy. Cleft lip may occur alone, or it can be associated with cleft palate, forming a condition known as cleft lip and palate. The incidence varies geographically, but according to Kadir et al., cleft lip palate have an overall incidence of 1 in 1000 live births, with a higher prevalence in certain ethnic groups. Coming to the classifications of cleft lip, various classifications have been proposed which are being displayed on my screen. You may take a while to pause the video and take the screenshot of these classifications. Moving forward, cleft lips are classified based on their anatomical presentation as unilateral cleft lip. This is when the cleft occurs on one side of the lip. It can be incomplete, meaning the cleft doesn't reach the nostril. It can also be complete when it extends to the nasal floor. Bilateral cleft lip, this occurs on both sides of the lip and may also extend to the nose. In case of a bilateral cleft, the prolabium or the middle section of the upper lip may appear detached. Then the microform cleft lip, this is a very mild form of cleft, sometimes appearing as a small notch or groove in the lip without significant functional impact, but may still require surgery for aesthetic concerns. Each classification helps guide surgical planning as well as help in patient care. Coming to the clinical assessment and diagnosis. Clinical assessment begins right after the birth, and thorough examination is critical to determine the type and extent of the cleft. A comprehensive evaluation indicates both functional as well as aesthetic aspects. Key points to assess include the integrity of the lip, the nasal floor, and the alveolar ridge, associated conditions such as cleft palate or other congenital syndromes, feeding difficulties which are common in cleft cases due to issues with sucking and proper lip seal. Advanced diagnostic imaging, including prenatal ultrasounds and postnatal CT or MRI, can help in assessing the cleft severity, especially when planning for surgical repair. Coming to the surgical management part, surgical correction of cleft lip is usually performed within the first 3 to 6 months of life, depending on the infant's health and nutritional status. The timing and technique used are crucial for optimizing both the aesthetic as well as functional outcomes. There are several surgical techniques, with two of the most commonly used being Millard's rotation and Tennyson-Randall triangular flap. Millard's rotation advancement flap. This is the most widely used technique for unilateral cleft lip repair.